Cerebral palsy is the most common cause affecting the physical disability of a cerebral palsy children. Prevalence is 2 per 1,000 live births. Hip dysplasia is the second most common problem after the equinus. Incidence of hip displacement in CP is 35%. Factors deciding the risk of hip displacement is age. Younger the age group, lesser the chances of hip displacement. Severity, spastic quadriplegics are more prone for the hip displacement than the spastic diplegics. And as the GMS level increases, the chances of hip displacement increases. Hip surveillance also includes the children which are irregular in follow-up and outside of the tertiary referral centers. Our objectives of the study was to develop standardized hip surveillance protocol, prevent occurrence of hip dislocation and severe deformities, improve the cooperation between the various professionals, and develop a CP registry. Inclusion criteria, we included age group between 2 years to 16 years, which were diagnosed with CP or CP-like disorders. Ethical approval was obtained from the Institutional Ethical Committee. Then examination were done by the pediatric neurologist and the pediatric orthopedist, and unique ID was created for the same. This was how we measured the hip abduction angle. Position of the patient while taking X-ray, pelvis should be horizontal, hips and legs should be in neutral adduction, abduction, patella should be pointing forward, and if a hip flexion contracture is present, we should position the lower legs on a pillow to prevent anterior pelvic tilt and lumbar lordosis. This was how we measured a migration percentage, in which the white line shows the lateral part of the femoral epiphysis, black line touches the medial part of the femoral epiphysis. The grey line touching the lateral edge of acetabulum divided by 10 into the 100 shows the migration percentage. Results we found out directly referred to ortho was 63 patients, referred from neuro were 56 patients, and physio referred were 31 patients. Number of children total enrolled till 1 year period is 150, with average age of 4.99 years, with range of 2 to 16 years. Number of kids in different GMS level, GMS 1 were total 16, GMS 2 40, GMS 3 15, GMS 4 42 children, and GMS 5 37 children. Number of unilateral involvement, that was 42 patients, and number of bilateral involvement was 108. The hip abduction angle average we found was 35, with the range of -30 to 60 degree, and migration percentage we found average was 18.2%, with range of 0 to 100%. 33 patients were diagnosed as red flag patients, which meant that migration percentage was greater than 30%, in which the GMSs 4 and 5 were concluded in 90% of the patients, in which the hip abduction angle average was 19, with the range of -30 to 50 degree. Average age was 5.3, with the range of 2 to 13 years, and migration percentage 42%, with the range of 30 to 100%. In interventions, 22 children were with 30% migraine pain were put on physiotherapy and 6 monthly follow-up, and remaining 11 children were given dates for surgery. Lasseram et al. In a discussion showed that the etiology of CP in 70% cases due to perinatal and postnatal factors in the developed countries, and in prenatal causes the main problem in developing countries. In analysis of 1212 children in North India, spastic quadriplegia was found common in developing country, and spastic diplegia in developed country. Birth asphyxia and sepsis were common causes in CP in developing country, and prematurity most common in developed country. In a Kunju et al. Study, RMP was greater than 30%, only 2 cases of hemiplegics, and 100% children was spastic quadriplegia with the hip displacement of greater than 33%. To conclude, hip displacement cerebral palsy is an insidious and progressive problem with poor outcomes if left untreated. Universal hip surveillance in children with cerebral palsy using a standardized protocol has the potential to diagnose hip displacement early. And existing hip surveillance models can serve as a framework to formulate guidelines and develop a referral care pathway that is appropriate for our healthcare system.
Thank you, Dr. Nihit.